Hi, my name's Lauren, and my presentation's on rheumatoid arthritis. Rheumatoid arthritis affects the lining of the joints, which damages the tissue that covers the end of the bone. The lining of the joints experiences painful swelling that can result in bone erosion or joint deformity. On the picture to the right, you can see a normal joint versus a joint with rheumatoid arthritis. There's obvious erosion and swelling there. Rheumatoid arthritis can affect joints all over the body and can cause problems outside of the joints as well. For example, problems with the heart, lungs, nerves, eyes, and more. Rheumatoid arthritis is a chronic inflammatory and autoimmune disease that causes inflammation to mostly joints and usually many joints at one time. An autoimmune disease is when your immune system mistakenly attacks your own tissue. There are two categories to rheumatoid arthritis. There's seropositive and seronegative. Seropositive rheumatoid arthritis is when blood tests show unusually high levels of antibodies called anti-CCPs. And seronegative is when there's not these unusually high levels. The target population of rheumatoid arthritis includes those of older age and specifically women. I found an interesting quote from the World Health Organization. It says about 70% of people living with rheumatoid arthritis are women and 55% are older than 55 years old. I found that super interesting. The pathophysiology of rheumatoid arthritis is that there's a presence of autoantibodies, which are rheumatoid factors and anti-citrullinated peptide antibodies, ACPA. These autoantibodies are directed against native antibodies. This causes the lining of the joint to become inflamed and cause tissue damage that can lead to long-lasting chronic pain, loss of balance, or things like deformities. Rheumatoid arthritis can occur because of many different reasons. Usually it's because of genetics, but it can also be because of environmental triggers or even just because of chance. Risk factors include smoking, family history of rheumatoid arthritis, obesity, genetic factors, lung diseases, gum diseases, and of course, age and sex again. This is my concept map for rheumatoid arthritis. It includes things we've already discussed in this presentation, like risk factors and the pathophysiology, but also includes other things. I included the pharmacology, which is the common drugs associated with treating the disease. Here I listed non-steroidal anti-inflammatory agents, corticosteroids, and disease-modifying anti-rheumatic drugs. I also listed drugs that would probably be administered with their specific names under these categories. The goal for these drugs, or the desired outcome, are to reduce joint inflammation and pain, maximize joint function, and prevent or at least slow down the destruction and deformity of the joints. I also included past medical history that can be related to the disease. For example, past injury to joints, lung disease, family history. These are all important because it can lead doctors to the right direction of this diagnosis. I also included the physical assessment that you would perform when looking for something like rheumatoid arthritis. This includes examining the joints, assessing gait, bending down, performing ADLs, nodules on the skin, listening to the chest for inflammation in the lungs, assessing for swelling, redness, or warmth, and assessing for muscle strength. Symptoms of rheumatoid arthritis include pain and aches in more than one joint, stiffening in the joint, tenderness and swelling, fatigue and weakness, and I find interesting, same symptoms on both sides of the body. These symptoms can lead to other factors as well, like weight loss or muscle atrophy. Classic findings for after a physical examination would be rheumatoid nodules, again, stiffness, tenderness, swelling, and redness, pain and or limitation with motion, decreased breath sounds in both lungs, and muscle atrophy. Also, they might already see deformities of the joints. I included some examples right here, which would be a boutonniere deformity or a swan neck deformity. For example, the boutonniere deformity is a non-reducible flexion of the joint of the finger. Diagnosing rheumatoid arthritis is slightly more challenging than other diseases because there's no one true test to confirm this disease, but there are other ways to make this diagnosis. Of course, medical history and physical examination is a key way to do this, as there are things you can see with your eyes that can lead you to this. Blood tests may also be administered to test for RF, anti-CCP, ESR, CRP, or blood cell count. The doctor may order other blood tests as well for things like kidney function, electrolyte levels, etc., as that can also lead them to this diagnosis. The blood test for anti-CCP is known as the gold standard diagnosis test for rheumatoid arthritis, as it is 97% specific for rheumatoid arthritis. Imaging tests may also be done, as it is critical to check for joint damage or progression. These tests can range from x-rays to MRIs, bone scans, and TC scans. It's super important to see what you can't see on the surface. Nursing implications for when caring for patients with rheumatoid arthritis would be providing firm mattresses and supportive pillows to support the joints, provide alternative therapies like massages, apply heat to the affected areas to give some relief, administer medications timely and appropriately, making sure that you're giving it at the correct time daily and the correct dosage. Administer medications that will help with inflammation or pain, making sure you're giving the right medication and ones that actually help. Encourage a balance of rest and exercise. This is to stray away from muscle atrophy and keep that strength. Refer to physical therapy. They can also teach range of motion exercises and encourage activity. And ensure adequate nutrition. This can be making sure they have foods high in protein and high in vitamins. That is all for my presentation on rheumatoid arthritis. Now showing my references. The last slide is the references for the concept map, and I hope you enjoyed.